Today we are here to talk all about nutrition and health. Now, you might have heard about ChildFund, which is a leading international child development organization. Now, it has been working in India for ever since 1951. So, for the past 69 years, ChildFund India has been working extensively with children which are deprived, excluded, and belong from the most vulnerable and marginalized communities of India, which are hard to reach. Now, the Child Fund organization itself reaches almost 3 million children, youth, and their families, and they have covered more than 3,000 families in 85 districts of 15 states. Now, today we are joined with Ms. Pratibha Pandey, who is a health and nutritional specialist with Child Fund India. Thank you, ma'am, for joining us.
My pleasure.
So, ma'am, my first question to you would be this Machan program that is in association with Child Fund. Could you walk us through that?
Okay, so Machan means, it's an abbreviation. Machan means Mother and Child Health and Nutrition Program. We are doing this program from last 2 years, but nutrition is not new to Child Fund India. So we believe, Child Fund India believe in life cycle approach, and we start interventions for nutrition before the child is born, like starting with the pregnant mother, and before that also we work with the adolescents so that their nutritional status are improved. And from if adolescents, because it's a fact, and there are evidences that when we start working with adolescents, the early we intervene, the better are the result. And to fight with undernutrition, it is required to start working earlier, very early, and go through the life cycle approach, working with adolescent, mothers, newborns, and then children. So all this in a complete package, if you give, then only from our country we can remove malnutrition, and we will become a malnutrition-free country.
So, ma'am, as you say, as you talk about malnutrition, what is malnutrition in kids? Like, what are the challenges that come with it?
So malnutrition, there are various kinds of malnutrition. So a person has to eat a balanced diet so that he or she is nourished. And if there is a deficiency of one or two nutrients, so nutrient is a big subject. For example, there are macronutrients and then there are micronutrients. Macro as protein, which we required in big amounts, protein, carbohydrate, fats, and then comes the micronutrients. We required in a specific quantity to grow properly, and it impacts the health also. If there is a deficiency of that, we call it malnutrition. So malnutrition are both, like if a child is not eating properly and he's not getting micronutrients, which is required for his growth, he will be undernourished. But if we are taking it in more amount, like obesity and overweight people, that is also malnourishment. Also, if there are micronutrients deficiencies like iron, zinc, and all other micronutrients, we call it deficient in micronutrient, which is hidden hunger. So malnutrition comprises of all these three groups: undernutrition, overnutrition, and hidden nutrition. So, and the challenges we majorly face where we work, because we work in urban slums and also in rural locations, which are very hard to reach locations. We find, including the tribal locations, we find first problem we found is the lack of food insecurities over there, because they are poor people, so they only afford two times a meal, and that too they focus more on carbohydrate, energy giving food, and proteins are majorly missing, and leave the micronutrient, which is even more difficult to see. That is the one issue we face. One is the food insecurity, and then we find there are lots of myths and misconceptions related to food. We always speak about food diversity, like a child should be given, a mother should be given a variety of fruits and vegetables, but we see that this rural people, and in urban slums, there are lots of myths, lots of misconceptions. There are lots of taboos attached to food, which is contributing to the malnutrition, I feel.
Which comes to my next question, that you work with pregnant mothers, their nutrition. So what are the some of could you walk us through some of the myths that are related to the mothers and the child's health, and what are the facts, actual facts?
So in our country, everybody is doctor. No, we say everybody is a nutritionist. So when it starts with the pregnant mother, there are lots of myths. Like for example, the first step in the first semester in many locations, as I said, pregnant mother has to eat food which we very in a very simple way हम कहते हैं तिरंगा खाना खाओ, जिसमें 3 रंग का खाना हो green, yellow हो और सफेद हो. तो in white they should be eating rice, milk, and roti. In green vegetable, and yellow in. But and if it is there in their thali, that in her thali, we say she is eating a balanced diet. But when a woman is pregnant, the mother-in-laws who are the gatekeepers, and also the cultural barriers are that, for example, a woman is not given to eat papaya. She is not even given to eat oranges. Also, there are many myths. She can't eat jowar because it leads to, it can lead to, it is their myth that it can lead to abortion and miscarriages and other things also. And in every month, this is changing. Like in first semester, they will say not this eating, and the second semester, something else. So which really makes her anemic. And in that, and one of the most common myths all over the country is that a woman required more anemia, and for that वो खट्टा खाना पसंद करती है. But you see, mother-in-laws मना करती है, no, don't eat खट्टा. And even the adolescent girls, they are not allowed to eat khatta, and that is required to absorb the iron. So it's one of the myths you find all over the India. For the children, lots of myth. Like for example, children are breastfed till 6 months, which is required. You see, when the child is born, colostrum is thrown out because it is thought that it is a bad milk. Okay, it should not be given to the child. Whereas it is a very high, which is very good for child, and it is the first vaccination. Child is not given anything to drink. It is not given to mother to have a breastfeed unless उसकी ना बुआ नहीं आ जाती. तो बुआ आएगी तो उसको there are very rituals कि वो बुआ आएगी, उसको कुछ नेग मिलेगा, तभी वो माँ को दूध पिलाना होगा. So you see, the first vaccination is missing. Till 6 months, it should not be given, but child is given honey and good and other things which will lead to infection in children, and also water is not required, but it is given. And even after 6 months, we say we start the complementary feeding, other foods, give other foods to eat, but it is not given because the myth is that if the child will start eating rice in some location, the stomach jo uska pet aage nikal jayega, which is actually a kwashiorkor, which is happening due to because children is not given rice and wheat to eat. But if the child is happening, they say don't give it because the child will have that. Children are not given bananas in winters. In our areas also, not only banana, the seasonal fruits and vegetables, there are lots of myths. Oranges, grapes, all these seasonal fruits which are not very costly are more healthy than and equally healthy than the other either fruits. But you see, dahi, like curd, is very common. It should not be eaten in winter, but it has nothing to do with winter or summer. It can be eaten in any season, unless until a nutritionist or doctor prescribes and a person has a medical condition. But these myths leads to a lot of malnutrition in our country, which I am observing all over the India.
Ma'am, now September has been declared as a month of nutrition, as we know. So what is the work that the organization is doing especially for this month? What exactly are we looking at?
We work this month. The September month is a nutrition month, and so we work in closely with Poshan Abhiyan, which is the national program to improve the nutritional status of children and mothers and adolescents. Through Poshan Abhiyan, we provide, we work with the district task forces and work with the government to establish nutritional rehabilitation centers at the district level. And not only that, in this month, we door to door, we we have a mentor mothers in Machan project. So mentor mothers are the mothers from the local community, from the village only. She is trained on nutritional aspects, health aspect, and she gives messages to other women of her community, of who are in her neighborhood. So she becomes links between Asha worker and the community. She does food demos, like whatever the food is available in that community, that food is only modified and make nutrient rich, because due to modernization, because these our cultural food is really very nutritious, but due to modernization, and somewhere they also feel that urban food like cornflakes or whatever we eat, like white bread we eat in urban areas, so they feel it is good, and they try to replicate. They do that, which is not a good. So we are all these things we do with the support of government. Whatever the camps are happening through government, we our mentor mothers and our community mobilizations are the part of it. And we are the part of district nutrition task force wherever we are doing our projects on nutrition.
You also in very different parts and of different community, you train mothers locally source ingredients, and walk us through that, because you make sure that those ingredients are first teamed up with scientific benefits, and that's when you tell those mothers to use those local ingredients. In fact, if I'm not wrong, you even teach them some of the recipes that they can use to provide nutrition to their child.
So what we do is we have a process of doing that. In every community, the food habits are different. People prefer different kinds of food. They have different food habits. So we don't want to change the food habits which are good, and it is very difficult to change culturally. And we, as I said, the culturally recognized whatever we were eating is the best food, but we have altered it because of different reasons. So what we do, we first do the assessment that what are the food habits of the people in that community, because there are veg food habits, non and other. And then we make a chart of it, like these are the 24 food items which these people eat. This 5 villages of this women, they eat these things. And on that only we see that what are the bad habits of foods. Like cooking, maybe the way of cooking is wrong over there. The way they are using it, they are making it is wrong. So we just outlined that what are these bad practices, and there are some good practices also which grandmothers were doing, what these women are doing. So we just make a list of it, and we promote the good habits and add few more foods to it. For example, ragi is very famous in Chhattisgarh, but they are leaving it. So they have some dishes. We also add dishes through ragi or from ragi, so that they can have it. And also we do demo, like we do 12-day session with mothers, pregnant mothers and the mothers who have a children. And those session, every day we try to make a new dish, and they eat it also. And we also publish booklets, recipe booklet, where so that they can after all also they can try it. And this way we are promoting seasonal fruits and seasonal and culturally appropriate foods which are highly nutritious and can be accommodated in that location.
Ma'am, you're an expert and specialist. I wanted to know now during the time of this pandemic. Now, the major challenge that India is facing is, feeding people, and this is just becoming bigger and bigger along with the outbreak itself. Now, many schools have been closed, and so are the midday meals, and there are many families who are facing financial crisis or up to the mark where they cannot feed their children or provide with the meals that they were supposedly given in the school. So I want to know your opinion here. What is your point of view in this? Is the organization looking at this sector?
So I'm a very big promoter of, every nutritionist is a very big promoter of midday meal scheme, because these midday meal schemes were addressing the food insecurity, which is very, very prevalent in our country. And the recent findings from UNICEF has came out that they are saying that only 8% children in our country is getting the complete diet which is required to grow and nourish in our country. and food insecurity is also more than 30% in our
Yes.
country. So looking at all these scenarios, midday meal scheme was a boom for these poor children. They were coming to the school, and also enrollment was increased. Enrollment become doubles by the time midday meal was introduced. Uh, I Now, because it is closed, the food insecurity is insecurities has increased. The different evidences are showing, and there are published evidences, and it also saying that due to the lockdown and other thing, 7.8 lakh children in our country would be dying because of uh, lockdown. So I feel like a government should have a plan for it. And like in some of the state, what the government has done is they are providing free ration uh, to the families from where the children were coming to the school. In some state, like there are voucher system also. Vouchers are given to the family so that they can afford it. So that also due to this lockdown and COVID, you see, the livelihood was also a problem, because these
Yeah.
laborers, they lost their livelihood. And adding to that was the children was not getting midday meal. Some of the children in our location, I found, they don't have breakfast in the morning, and they come to the school for the midday meal. So we can see how the how like these people would have been suffering because of midday meal school scheme is closed. In our location, what we have done is we have already provided dry rations to these families who are highly vulnerable, who do not have any livelihood options to dry ration of 2-3 months. We have already done it for this COVID. And besides that, there were community kitchen, because we work with local partners. So we have promoted our local partners to have a community kitchen over there, so that these people can come and have food. Also linking them to other social security schemes, because the government has announced so many social security schemes during this lockdown. So linking them to that, because these are poor people. They do not, some of them do not have even the Aadhaar card and all that. So Child Fund India has closely worked with them so that they can get the benefits of all the social security scheme, including food related all the schemes, so that they can have food in their houses. We have also provided livelihood options to them also in Child Fund, like
Okay.
training them in skill based training. We have provided to them. We do poultry. We do poultry in many of the location. So livelihood is our is also one of our pillar, where we work with them. And in this COVID-19 situation, we have been able to do that.
So, ma'am, now that you say that, how do you make that there is a community involvement with the government? Like, even if we consider Machan program, how do you make sure that there is a certain kind of association between the community as well as the government? And also, I would like to know, now that you've worked in almost 15 states of India, which are some of the states which are really performing good in terms of associating themselves with organization like yours?
Okay. So uh, uh, okay. So I will say that. The community level, there are so many things which we are doing, which can be a big thing, which we can share with the government, and they can also take it. And it's not different from the what government was doing, but we are doing is what lot of hand holding support, home visit to the children who are SAM and MAM. SAM is like, SAM children are severely malnourished and moderately malnourished children. Besides that, Anganwadi workers, when this COVID happened, they closed their Anganwadi centers. But after that, like through our support, and also there was guideline that she should be going to the households and providing the supplementary nutrition. So we did that. In the community, like we are also have done kitchen garden, nutrition
Okay.
garden, which is a based intervention. And from the kitchen garden, they know the importance of what is of food, and they are having having leafy vegetable from that nutrition and kitchen garden over there. As I said earlier, we do PD, positive deviance plus, where the women come, they cook and they learn also and they eat also. So these kinds of program we have done over, done that we are doing with them. Besides that, we provide Nutrimix. So Nutrimix is the combination of some crop, some cereals, pulses, which is rich in protein and carbohydrate, and which can be, which is given to the children and pregnant mothers so that they can consume it. And that is community based, because these are made by the community women only. So these kinds of things which have things which we have done at the community level, so that this can be tackled.
Ma'am, in 16 years of more than 16 years of your experience, अब जो कि हम mother और child की nutrition की बात करते हैं, what according to you, of all the experience that you have, what according to you are the major factors that we really need to shift our attention to when it comes to a mother and a child health?
Okay, so which is important for mothers and child health, you're saying?
Yeah,
So
yeah.
for mother and child health, which is the most important thing, I will say is mothers, they don't pay focus to themselves, their diet, health, and we called it the health seeking behavior for mother, which is very poor in our country. Besides that, the gender biases are there, which is leading to a mother to have food after everybody eats, whereas mothers, girls, and the children, they should be prioritized first to have a good food. So it needs lots of change from the society in the community, because we will bring different programs, another portion of Abhiyan will come, but unless until these underlying causes are addressed, malnutrition would be difficult to be eradicated from our country. I already said, because in some areas we already have food, we have nutrition over there, but they are not eating it because there are lots of gender biases are there, taboos are there, and they don't have access to the services. So they should, a woman should first, message should be, they should first prioritize her health, her nutrition, so that the child is healthy, because she is the leader, she is the main worker of the household. She's not the secondary one where it is considered in rural area. So whenever she has a problem, she should eat balanced diet, and whenever she has any health issue, she should go to the doctor, consult a doctor, and take proper advice. That I feel is important for a woman.
Well, I think in this burning issue of the time, everybody has to do their bits and contribute to these marginalized section of the society. But thank you so much, ma'am, for joining us and giving us and fostering us with so much of knowledge. I believe especially the myths and facts that you have cleared is going to be of utmost use to people who will be watching this. Thank you so much for joining us, ma'am. Thank you.
Thank you.